So my name is Lucenia Ortiz, and it's spelled Lucenia Ortiz, and I was born on October 8, 1953. Uh, I'm not sure if you're familiar with Philippine history, but I grew up under the dictatorship
Okay.
of the Marcos regime. Was in the uh, late 60s, 70s, and on to the 80s. So really, when I was growing up, I have no idea of what civil liberties are
Okay.
to a certain extent, because that was not uh, that has diminished because of martial law. But just before martial law was declared, I was very freshman from university. And what got me interested is a very local issue. It was about increasing tuition fees.
Okay.
So I'm studying in a state university, and so we were protesting against increased tuition fee because the Marcos regime chose military spending instead over education. But as I was getting involved in that very local issue, I also got to know that there are broader systemic issues in society,
Mm-hmm.
and that awareness has led me to become sensitized
Mm-hmm.
to the presence of an oppressive regime that has silenced opposition for almost 20 years.
Yeah.
I have not experienced a free press
Mm-hmm.
in the Philippines. Most of the newspapers that we read or things that we watch on TV
Mm-hmm.
have all been, how do you say that, sanitized to prop up the regime. But I think for me, because I had that initiation into activism just before martial law was declared.
Mm-hmm.
um, I was actually a college counselor
Oh wow.
in the university at the time,
Yeah.
and we were supposed to have our first council meetings, student council meeting, that Saturday.
Wow.
And Saturday, early Saturday morning, that was when it was declared. So I never got to serve on council
Wow.
at the time. So, anyways, but that has actually, at least from my own personal experience, that has actually uh, made me motivated,
Mm-hmm.
to work towards social change.
Mm-hmm.
And so the people power in 1986, when the people toppled the Marcos regime. It was years and years of organizing. It didn't just happen on that day
Yeah.
or those 3 days where we all march in the streets,
Mm-hmm.
right? It happened of years and years of organizing across the country. And so activists were involved in organizing, educating, creating awareness
Mm-hmm.
among the people that this is a situation, a regime that needs to be overthrown because it has oppressed
Mm-hmm.
many Filipinos.
Yeah.
So, and then, when the Marcos government was overthrown, and I was already working
Mm-hmm.
at that time. I graduated from college. So we were one of the first few volunteers that were recruited to actually review and look at how can government change in the way that they do. It was hard work
Yeah. To
trying
imagine.
to overhaul the how do you say that, the structures and institutions of an oppressive regime.
Yeah. That sounds almost insurmountable when you say it that
Hmm.
way. Mm-hmm.
And so, and we were also involved in developing innovations
Mm-hmm.
that will actually engage people uh, rather than just impose things on them.
Okay.
So one of the things that we worked on before I left the Philippines was restructuring the entire. We were one of the teams that helped the government restructure the healthcare system.
Mm-hmm.
So we developed a program called the Village Health Workers Program, where it increased access to primary health services to the most far-flung areas in the Philippines. So it's still the same health system that they have done, starting from the community ground up.
That's wonderful.
Mm-hmm.
So you built this very meaningful foundation back in the Philippines. How did you move that into coming here and joining us in Edmonton and bringing your wealth of knowledge here?
So I arrived here in 1994,
Mm-hmm.
very hopeful with my family, and so back home in the Philippines, so my undergrad is public health. So even at the time, I really was into community work,
Mm-hmm.
and then I said I should use my community grounding to a much more strategic level. So I took a master's in urban and regional planning.
Okay.
So when I came here, I was hoping I would get work in the planning field, but it was it was very hard with licensure requirements. So I said maybe I should try my community development experience to find work.
Mm-hmm.
And that's where I actually met Yvonne Chu from the Multicultural Health Brokers Co-op. At the time, there was no co-op yet, but she was involved in helping immigrant women find prenatal support,
Mm-hmm.
especially for moms who had their first pregnancy here
Okay.
in Canada. And so I said, well, this is community development work. It involves working with immigrant women who are actually vulnerable and marginalized from from basic healthcare services.
Mm-hmm.
So I worked with her along with 12 other immigrant women who feel a need to support their communities. And so, I mean, I think the rest is history. We also decided to adopt a cooperative structure
Mm-hmm.
rather than the traditional not-for-profit organization, because a cooperative structure is founded on democratic governance.
Mm-hmm.
So our workers, actually, we as workers, make decisions for the organization.
Mm-hmm.
So we are both workers,
Mm-hmm.
members, and owners
Yeah.
of the cooperative. So even at the time, participatory development and democratic governance are key to the work that we do, and that has always been the values that we have that we have been committed over the years.
As you've worked with multicultural
Yeah.
health brokers.
Mm-hmm.
That's wonderful. And so, wondering where to go next. I see that you've used processes to help build up resilience and self-advocacy in communities, and I'm kind of hearing you talk about that, and even how you helped organize multicultural health brokers, right? There's that piece around inclusion and being cooperative and creating community and really building that foundation for the organization, but also for everybody you bring into that. And how does that help as you advocate for people or helping people advocate for themselves?
So we've always believed that people are the center of their development.
Yeah.
They are their own change agents, and so with that as our guiding value, is that whenever we engage the community, we always make sure that they participate. Not just we participate at the very start, not just in identifying the problems or the challenges and the issues they encounter, but also in finding solutions
Okay.
to this. Now there is a very recently we found a model developed by Dr. Tara Yoso in her work with African youth. It's called the community cultural wealth,
Okay.
and and I thought that really speaks of migrants who have made Canada their home. So in that concept is that be more than just the economic skills, as we all know, that many migrants bring to Canada.
Yeah.
Dr. Yoso said that we have immense community cultural wealth, and she has identified this as social capital, which is our ability to build networks,
Yeah.
relationships, and connection among each other, and familial capital, the family values that we hold that actually supports the many challenges that we experience. Then there is, of course, linguistic capital, so the rich diversity of languages that we bring. Then she also calls navigational capital, which means if you were someone who have actually applied for a for permanent residency or refugee or whatever means of going into Canada,
Yeah.
you can imagine how much navigation that you have to do. It's actually a complex process.
It is. Yeah.
And to be able to get over that, well, you must have some skills in terms of navigating processes and systems.
Yeah.
But the one that I like the most is called resistance capital. And I'd actually want to read it because I don't want to miss the words, if I may.
Yeah, go for it.
So I did take notes. So resistance capital refers to the historical legacy and experience that migrants bring in challenging inequalities in their home countries.
Okay.
Their experience of securing equal rights and freedom, tackling challenging problems in the midst of scarcity, and believing in the collective power of people are essential in community building work. Many of the migrants who have come here were activists and advocates in their home countries because their home countries also have been impoverished by colonization.
Yeah.
That has made them decide to move to another country to seek a better future.
Yeah.
So what Dr. Yoso is saying, resistance capital is an untapped cultural wealth that migrants bring, and so this is something because we still know that many migrants are still experiencing barriers and challenges to be able to live a better life here in Canada. And this is one wealth that we still have to tap. Although in recent times we know that particularly after the anti-racism movement during COVID, was that there was just an emergence of advocacy groups among ethnocultural communities. So I think if you are creating processes to engage migrant communities in advocacy, I think the community cultural wealth model is a good model by which to ground the work.
Yeah, it sounds like it. I'm wondering, I have so many questions from everything you just said, but I'm wondering, as an advocate, how does somebody even start with the understanding that they need to have like the beginning foundation of cultural competence or cultural awareness, or I think you talk about intercultural competence too. So even just having that understanding, how do we bring that into advocacy so that we have the space to bring this community cultural wealth and the social capital and all of that?
So when it's all, I always say, well, we have to start with your own story, right?
Yes.
if you were if you were an immigrant
Mm-hmm.
who have come here to, or your family have come here to Canada, is to start, what's your story?
Mm-hmm.
What was your journey? How and why did you come to Canada? And
Mm-hmm.
what was life here?
Mm-hmm.
Because once you begin to unpack this, then you will note that truly there are many things that could have happened,
Mm-hmm.
but there were barriers, right? And so, in, and so if you start with your own story, that gives you the context,
Mm-hmm.
and then to see whether your story also speaks of the many stories of that migrants have
Mm-hmm.
in Canada.